Добрий день.
Good morning, all. I want to thank everybody who joined us. It's Olga Atamanova, Media Center of Ukraine. Ukraine Forum continues its operation. It's day 253 of our fight for freedom. And now we will be talking about the health of Ukrainian nation. We will have Mykhailo Radutskyi online, the chair of Parliamentary Committee on National Health, Medical Assistance and Medical Insurance. Mr. Mykhailo, good morning. Good morning, glory to Ukraine, glory to the heroes. Mr. Mykhailo, let's start with the situation with the level of COVID-19 cases in our country. What was this level? Well, even today we see a decrease in the number of those getting sick compared to the last week or 2 weeks ago. As of today, it's about 16,000 cases and 3,000 hospitalizations. It's in average, it's lower than about 1,000 than a week ago. However, on the other hand, we observe a drastic increase in the growth of cases in the European countries and in Poland in particular. Well, we have crossing borders, borders crossed by both Polish and Ukrainian citizens, both ways with the aid, with humanitarian supplies. And we can assume that we cannot say that this wave of this year has already passed. Okay, talking about this wave of COVID, can you please give us an information on how difficult is the illness and number of lethal cases? How did it change? Well, it's not year 2020, not even 2021, but I think it's thanks to those that Ukrainians stopped listening to Skabeyevas and their agents here in Ukraine, like different Stremosov. As you remember, he was one of the biggest anti-vaccination meetings, and now he's a collaborationist who is governor of the occupied Kherson region. So our citizens stop listening to them, and many people get vaccinated. This week we got 50,000 people vaccinated with booster dose, and now the sickness goes easier in cases of those vaccinated. The strain is not that lethal as previously. We have a huge decrease in the number of lethal cases compared to the last year. However, the disease is still vile. Those who neglect to go to the doctor and neglect vaccination, their sickness is heavy. Mr. Mykhailo, let's talk about the availability of vaccines. Are they available, and where people can in fact get vaccinated? If we talk about the areas controlled by the Ukrainian government, our territories, it's no problem at all. We received from UNICEF a couple million doses of vaccines. 300,000 doses are disseminated around the regions of Ukraine. We have Pfizer from UNICEF and CoronaVac. We received this Pfizer as a booster dose. So it's a vaccine developed specifically as a booster dose, not as a primary vaccination. So there's no problem at all. People go to their family doctors, and there is no problem with vaccination in the country. Unfortunately, now we see a little decrease in numbers of those vaccinated. As I mentioned, 50,000 people last week, but we can blame it on terroristic acts happening last week, and this is probably what influenced the pace of vaccination. Just like always in Ukraine, you have a choice of vaccine: CoronaVac, Pfizer. As to the problems with the vaccines, for those we have a lot of internally relocated people. Can they get vaccinated without any problem? Look, at the territories controlled by the Ukrainian government, no one is entitled to demand any proof of address of registration. If it's a citizen of Ukraine who has Ukrainian identification code, Ukrainian passport, such person cannot be refused vaccination in any place in Ukraine. We're talking about the territories controlled by Ukrainian government. As to the boosters, you mentioned that people started getting booster vaccines. What's the interval? It's 6 months. I already have my 4th booster dose, and I feel myself absolutely normal. As to the mask regimen, is it feasible, or such means would not be implemented? Well, let's put it this way. As of today, the government of Ukraine doesn't plan to implement the mask regimen because, first of all, it's not quite real. Nobody can deny a person's right, a person who takes care of their personal health. No one can deny the right to maintain social distance or wear a mask. But the health protection measures, they didn't change this year. They are the same as the last year, but in total, in Ukraine, government does not implement, and the local authorities don't forecast any implementation of such regime either, because any quarantine regime may be implemented by the local authorities or central government, but none of them, as to the best of my knowledge, plan to reinforce these health protection measures. Mr. Mykhailo, as to the seasonal illnesses, we understand that traditionally people start falling sick with flu. How did it increase recently, and are we ready for vaccination against flu? Do we have flu vaccines available? As of today in Ukraine, we observe a growth of number of those falling sick with flu. Just like the last year, God forbid, when 2 virus infections combined, COVID-19 and flu, we have such cases and people suffer it very bad. There are vaccines available in Ukraine for the groups of population not provided by the mandatory, like the military doctors, that they have the vaccines free of charge for those groups, or either procured by the government or received from international donors. But those who want to get vaccinated and fall out of these groups, they can buy it in the pharmacy. For example, in the committee, we get vaccinated and we buy it from the pharmacy, a French vaccine, Vaxigrip, and it costs about 300 hryvnias. It's developed for those strains that we await this year. So I call everybody to get vaccinated because it's the best means of protection. Mr. Mykhailo, is there a problem with any medicine supply or supplies of medical equipment, or everything goes according to the plan? Well, look, I cannot lie to you and tell you everything goes in full compliance with the place, because you know that the enemy destroyed a lot of logistic chains, so we have delays. But today, for example, yesterday I was visiting the oncological clinic in Kyiv region. Both me and the minister and the representatives of the president, we travel around the regions. Yes, some delays are seen, but there is no total problem, total deficit and issue with the supply of either medicines or medical equipment are not to be observed. The other problem is that the enemy either destroys or steals medical equipment, medical ambulance vehicles. You know, in Kherson region, they've stolen all the equipment available, so that's the problem that exists. But thanks to the donations through the United 24 platform and through government procurement, the Ministry of Health to more extent controls the situation. Mr. Mykhailo, what's with the resumption of operations in the liberated areas? To what extent did the medical institutions are relaunched in those areas? I mean, Kharkiv, Kherson region, the works on resumption of operations are in progress. In some places, it's impossible to resume due to full destruction to the ground, but for example, in Kyiv region, there is a reconstruction, and one clinic in Moshun, which was sponsored by the football club Dynamo Kyiv, and I got a report yesterday that one clinic will be reopened in Kyiv region by the end of this month. And so in other regions, maybe there is not enough time for to rebuild those clinics, so the ministry sends other field hospitals there or doctors with mobile equipment. Where it's feasible, we can resume operations, but where we cannot rebuild, it happens in this mode as I just mentioned. But as Zaluzhny says, even with the candlelight, we will win anyway. Our people are not going to be left behind without the care by the government, and without medical help. Thank you for this information. Dear colleagues, I will remind you we had Mykhailo Radutskyi with us, the chair of the Parliamentary Committee on Public Health, Medical Assistance and Medical Insurance. Thanks for joining our air, and our next briefing is at 12 o'clock, and we will talk about the situation in Kherson region. Bear with us. Glory to Ukraine.